And welcome back to Life Unrehearsed. Matt Delvecchio here, specializing in home care, elder care planning, and the senior living industry. Happy St. Paddy's Day as the sun tries to get out here to finish off the day. Sunset around 7 p.m. today. How about that? You know, we're always hearing about the challenges of our healthcare system and the long waiting lists and the lack of hospital beds. Well, the Hospital at Home program at the Jewish General Hospital could be a game changer. It offers certain patients the opportunity to continue their recovery in the comfort of their own homes. And using digital technology, they stay in touch with the hospital's virtual care team, which remotely monitors their vital signs on a regular basis. I just love this. And the goal is to enhance the patient's recuperation by having it take place in comfortable, familiar surroundings. And this initiative of having the care follow the patient embraces the care everywhere approach that is used by the CIUSSS West Central of Montreal, which the Jewish General Hospital is a part of. And joining us today is Erin Cook, Director of Quality, Transformation, Evaluation, Value, Ethics, and Virtual Care for the CIUSSS de Centre-Ouest-de-l'Île-de-Montréal, and Dr. Lawrence Rudski, Medical Director of the Azrieli Heart Center and Medical Director at Virtual Care. Erin and Dr. Rudski, welcome to Life Unrehearsed.
Good afternoon.
Well, thank you to both of you taking a little time here on St. Patrick's Day on a Sunday, and I love this Hospital at Home program. And so let's start. Where did the idea for this program begin?
So during the pandemic, the Jewish was the dedicated pandemic center, and we were caring for a large number of hospitalized COVID patients. And in the fifth wave, this was in January of 2022, it became especially challenging as we had a lot of people hospitalized and a lot of staff who also got COVID and they couldn't work. And so at this point, we're now in the fifth wave. We wanted to make sure we maintained access for our patients, avoid canceling surgeries. So it was a Friday afternoon at 2 p.m., a particularly challenging week. And our CEO called us into a meeting and said, we've got to do something. How about we implement a hospital at home, and let's try to get this done for Monday. So over the course of that weekend, Dr. Rudski and I, we sort of took the reins and ran with this. We mobilized over 70 people. On the Monday, we did a dry run, and we actually admitted our first patient on Tuesday.
Oh. Unbelievable. You know, we talk about the pandemic and there are silver linings all around. I think this is a perfect example of that. I'm sure both of you didn't get much sleep that weekend trying to organize all that, but wow, you turned that around quickly. I'd love to know, what's the criteria that patients have to meet to be eligible for this program?
Thanks, Matt. There are a number of criteria, both medical and socio-demographic, but the very first and most important one is, can we safely care? Can we provide the care that this patient needs within our program? So from a medical perspective, of course, we started with COVID and we continue treating COVID patients, but we've expanded, having built the infrastructure to heart patients and lung patients and certain infections and inflammatory disorders. We can take patients preoperatively waiting for a procedure inpatient, or postoperatively if they have some complications, or just for routine follow-up type procedures. And we've been able to greatly expand this because of incredible collaboration with our home care service within our CIUSSS and also our pharmacy. So we're constantly evolving and increasing our service offering. From a socio-demographic perspective, remember that the majority of these patients are actually elderly. Our average age is in the 80s. So we have a screening tool to make sure that their home is safe, that they have a caregiver. The large majority, over 95% of patients live with a caregiver. We also see where they live in terms of whether they live within our CIUSSS or outside of our CIUSSS to make sure we can offer them what they need. Because our CIUSSS is the most ethnically diverse CIUSSS in terms of number of countries and ethnicities, we strongly believe in equity in healthcare access. So it doesn't matter whether the patients actually have internet or phone even. We completely provide them with everything they need. They get an iPhone, they get a tablet, everything is with an LT chip. And we even are looking at that. We've started for certain languages translation services. So first and foremost, safe care, and then we make it easy for them.
Just amazing. Listen to Life Unrehearsed. Matt Delvecchio here, talking to Erin Cook and Dr. Lawrence Rudski about the Hospital at Home program. Very interesting you talk about the technology, because let's face it, this is technology for this to be successful. And many seniors and older adults may get a little nervous around technology. So I'm so glad to hear that you're even providing the technology and going through this with the caregiver and patient. So obviously, there are benefits, but can you outline some of the benefits of the Hospital at Home program?
Sure. What we learned over the years is the worst thing for an elderly person is to take them out of their usual environment and confine them to a bed or to a small little room. What ends up happening is they become deconditioned, they become confused, so they have a higher chance of falling. So by keeping them in their own environment with their loved ones, we avoid all this and we accelerate their healing process. In fact, from our outcomes, and every single patient gets a survey afterwards, everybody reports, really, it's uniform. Everybody reports that they appreciate and like the portion of care at home as opposed to while they're in the hospital. From a systems approach, you can obviously understand, and you've stated that everybody has problems accessing the emergency room. We need beds in order to perform cancer surgeries and heart surgeries. And it's incredible how even a relatively small increase in capacity can pay huge dividends to our very strained system. So our hospital home program is good for the one, and it's also good for the many.
Interesting. I don't know if you caught the first quarter of our show today, but it's World Social Worker Day this Tuesday, the 19th. And we were talking off air with the head of social worker of the social worker team at the MUHC, and I was talking about the your hospital home program, and it is a game changer, and that would just, I'm sure, not only improve the lives of the individual patients. At the end of the day, this is what it's about, but also the staff within the healthcare system. And if you're able to free up beds quicker and help the various team members, that's just fantastic and just really, really interesting. And I guess, Erin, would this one go to you in terms of the day-to-day life of someone within this program? Can you give, spell it out for our listeners? I know there was mention of that there needs to be, in all cases, a caregiver there with the patient. So what is it like in the day-to-day life of someone getting the hospital to home care program?
Yeah, so they really get all their care, the entire continuum of care taken care of by our virtual care team. So what happens is if they need some in-person visits that are really specific to interventions like changing a dressing, taking blood tests, getting an IV, this is all taken care of by our home care team that goes directly into their homes to facilitate that. We deliver all their medications to their home by our hospital pharmacy service. And naturally, as Lawrence alluded to, patients are monitored remotely using different types of devices that are chosen specific for that patient. So that can be a simple blood pressure cuff, or it might be a patch on their chest that's going to monitor their vital signs in real time so that our virtual nurses can keep a really close eye on them. Patient gets a planned Teams call with the nursing, medical, and allied health team that is designed around their specific needs. And that's going to vary in the number of times per day based on what the individual person needs. And if they need any in-person appointments, the transportation for that is ensured by our virtual care teams and our command center team.
Wow, that is just fascinating and well surrounded. You're not just leaving patients and their caregivers kind of on their own. They are very well surrounded. And like you say, most of the time we're dealing with seniors and older adults, and it could be nerve-wracking, I'm sure, especially post-hospital. We're talking with Erin Cook and Dr. Lawrence Rudski about the Hospital at Care program, Hospital at Home program at the Jewish General Hospital. Very interesting. We hope this doesn't get shut down. In fact, I would hope we can expand it. Dr. Rudski and Erin, I mean, there's a lot of challenges in the healthcare system right now. How do you see the future of the Hospital at Home program?
Well, you sort of touched on the fact that there are challenges, and it's not just in Quebec, it's also internationally. Healthcare is facing things that they never had in the past. We're seeing, a lot of staffing shortages that are linked to our aging population, and this is also resulting in an increased demand for healthcare. And, in Quebec, we're investing a lot in healthcare. The new budget was just released, and we see that a significant portion of our tax dollars are going towards healthcare, but we often fail to see what value it creates for the patient. And the Hospital at Home program actually responds to the needs by creating value in that they recover faster. They tell us they like it better. It uses less staff than a typical unit, 46% less, in fact. And it costs significantly less than it does to give the same care in hospital. So if we're looking at the sustainability of our healthcare system, it's important we're expanding these types of models to really create real value for our system and promote health and faster recovery. And in fact, good news, we've been working really closely with the Health Ministry, who's going to be launching an additional 8 programs across the province in the next few months, which is a huge win for patients. And so, as we move forward, we've got to keep thinking about how different care models can be put into place by leveraging technology so that we can improve healthcare in Quebec.
I love it, and I wish you continued success. So good to hear that it's possible, expanding throughout the province. It makes a lot of sense, and it's amazing what you've just described, and yet it's still less expensive than taking up a hospital bed on a day-to-day basis. So good on you and your team, both of you, Erin Cook and Dr. Rudski. I want to thank you very much for spreading the word about the Hospital at Home program.
Thank you for the opportunity.
All right, thank you. That's Erin Cook, Director of Quality Transformation, Evaluation, Value Ethics, and Virtual Care for the CIUSSS de Centre-Ouest-de-l'Île-de-Montréal, and Dr. Lawrence Rudski, Medical Director at the Azrieli Heart Center and Medical Director at Virtual Care, talking about the Hospital at Home program.